Welcome to Bolton Clark's Be Healthy and Active program. This session is falls prevention.
Hi, I'm Claudia from Bolton Clark, and today I'll be talking about falls prevention and the importance of keeping active for general health and well-being. A third of all people over 65 will fall at least once per year, and around half of these falls will be in and around their own home. There are a number of factors that can increase the likelihood of a fall, such as health conditions, medicines, changes to your eyesight, and feet. Some conditions such as stroke, Parkinson's disease, and arthritis can make you feel unsteady on your feet and affect your ability to move. They can make it more difficult to react quickly and regain your balance if you stumble. If you have diabetes with unstable blood sugar levels, you may feel faint. Diabetes can also cause problems with eyesight and reduce feeling in your feet and legs. Low blood pressure can make you lightheaded, dizzy, or unsteady when you stand up quickly. Even a short-term illness such as the flu or other infections can affect your balance. It's important to have regular checkups and talk to your doctor about how these conditions might affect you. A walking aid may help improve your safety and mobility. A physiotherapist can suggest the most suitable aid for you and show you how to use it. Some medicines can increase your chance of falling. This side effect varies from person to person, so it's important that you understand how your medication affects you. Some medicines, whether they are prescription or not, can make you dizzy or drowsy and make falls more likely. This is the case for medicines for anxiety, depression, sleeping difficulties, and blood pressure or heart medication. If you take 4 or more medicines a day, you are at higher risk of falling due to cross-reactivity and possible side effects. Some things you can do are to make a list of every medicine you take, including herbs and supplements, and take it with you when you go to see your doctors. Do this at least once a year. If you feel dizzy or find it hard to concentrate, contact your doctor straight away. If you take any blood thinning medicine and you have a fall, make sure you see your doctor, as you are at risk of injury and bleeding. Only take your own medicines and don't use someone else's, even if they are for the same condition. If you find it difficult to remember which medicines to take, ask your pharmacist or doctor for devices that may help, such as Webster packs. Always seek advice from your doctors or pharmacist if you have any of these side effects. Your eyes not only allow you to see obstacles and judge steps, they help you to keep your balance. But with age, eyesight gradually worsens and can lead to an increased risk of falling. You might find that you take longer to adjust to sudden changes in light and dark, you are more sensitive to glare, and you are less able to judge distance and depth, such as on stairs. Other eye conditions, such as macular degeneration or cataracts, can affect vision. It's important to have your eyes checked at least every 2 years. You may need a separate pair of glasses for outside and consider wearing a hat and sunglasses to reduce glare. Give your eyes time to adjust to sudden changes in light. Ensure good lighting at home and on stairs. Be especially careful when you get new glasses, as it takes time to adjust to them. And keep your glasses clean and always wear the correct glasses for the task. Healthy feet and well-fitted footwear help reduce your chances of tripping and falling. With age, your feet can change shape and lose some feeling and flexibility. This changes the way you walk and affects your balance. Keep your feet healthy by keeping your toenails trimmed and getting treatment for bunions, corns, and calluses. Avoid unsafe shoes. Shoes with slippery or worn soles are a balance hazard, particularly in bad weather. Narrow or high heels make the foot unstable when walking, and soft or stretched uppers or a lack of laces can make the foot slide around in the shoe. Safe shoes have laces or strong fastening to hold the foot firmly, a slip-resistant sole, a low square heel, and are correctly fitted. Other falls risk factors include the environment around your home and garden. You can download a home safety checklist from the Bolton Clark website to help identify any hazards in and around your home. Staying active is the most important thing you can do to stay as fit and independent as possible. As we age, you lose muscle strength and a sense of balance, which may lead to a fall. It is common for people who feel unsteady to do less walking, but over time, not walking actually makes you more likely to fall because your muscles get weaker, your joints stiffer, and your balance gets worse. Physical activity can improve balance, muscle strength and flexibility, keep bones strong, increase energy levels, help with sleeping problems, help control blood pressure, blood sugar levels and body weight, and help you feel good about life. Try to be active for at least 30 minutes each day, but it doesn't have to be all in one go. 10 to 15 minute slots during the day is just as good. Exercise should make you breathe a little harder, but not so hard that you can't talk. I'm going to demonstrate some strength and balance exercises that you can do at home. For these exercises, use a chair, bench top or wall nearby for support if you need. To make it harder, you can increase the number of each exercise or hold each one longer. Stay safe at all times, but challenge yourself as well. Use smooth movements and take your time, and stop exercising if you experience any unusual pain or discomfort, and seek advice from a health professional. Heel-toe standing or walking. So firstly, I want you to place one foot in front of the other. Bend the knees slightly and keep still for about 10 seconds. You can make it harder by putting the feet closer together, or easier by putting one foot halfway in front of the other. You can make it harder still by walking slowly, placing your heel to touch the toe of the other foot. Knee raises. This one is good for climbing stairs and getting in and out of cars. Lift one knee to hip level and hold it for about 5 seconds. Repeat with the other leg up to about 8 times on each. Make it harder by not holding on or holding just lightly with a finger, balancing on one leg. Side leg raise or sideways walking. This one is good for sidestepping an obstacle or when you are taking weight on one leg. Stand on one leg and raise the other one sideways, holding it for about 5 seconds. Repeat about 8 times and then do it with the other leg. To make it harder, you can walk sideways with slow steps along a bench or a table. Heel raise. This one is good for walking and climbing stairs. Lift both heels off the floor and stand on your toes for about 3 seconds, then slowly lower your heels back to the floor. Repeat 5 times. Stepping up a step. Holding onto a rail, go up and down a single step. Repeat 5 times leading with the right leg and then 5 times repeating with the left. Sit to stand. This helps with getting up and down from a chair or a toilet and in and out of the car. So stand up slowly from a chair, keeping your knees slightly apart and then back down again. Repeat 5 times. You can use the arms of the chair if you need, and you can make it harder by crossing your arms on your chest or holding your arms out in front. Now, what to do if you do fall? The first thing is to calm yourself down. Catch your breath. Scan your body to see if you are injured. If you think you can get up, roll onto your side, crawl or drag yourself to a chair, face the chair and get up onto your knees. Bring one knee forward and put that foot on the floor. Use the chair to push up with your arms until you are upright enough to pivot your bottom around to sit. If you can't bend your knees very well, slide along on your bottom and then lift your hips onto something higher, such as stairs. Then you can pull yourself upright again. Rest at any time, and if you do not succeed the first time, rest and try again. If you've had a fall, talk to your doctor as soon as you can especially if you take blood thinning medicine, you bumped your head and feel drowsy or unwell, you have unusual pain, or you are worried about falling again. It's not possible to predict if, where and when you may fall, so it's good to be prepared and have a plan in place. This will help you to not only feel safer, but more confident and in control. Suggestions for having a plan and the exercises I've just demonstrated can be found on the Bolton Clark website. I hope to see you at one of our falls prevention sessions soon.
For more information about the Be Healthy and Active program or to book a session, visit boltonclark.com.au/behealthy.